Hey Jillian, thanks so much. If you are a nurse or know and love one, you know that this season has been a really hard one to say the least. Dr. Anne-Marie Shank from our friends at Johnson Memorial Health is here to share about pandemic burnout within the nursing community and what we can do to support them. Dr. Shank, welcome to the show. Thanks for being here.
Thank you for having me.
How you doing?
I'm doing great.
All right.
Happy Friday.
Yes, happy Friday to you too. So how serious of a problem is this pandemic burnout within the nursing community?
It's significant. Nursing burnout's been a topic in our profession ever since I've been a nurse. But with the pandemic, it's really been heightened. I would liken it to true trauma related to the pandemic. We are losing nurses out of our profession because they are burnt out and choosing to do other things.
What are some of the most serious causes of burnout? Now, obviously the pandemic, but even when there's not a pandemic going on, what's just some of the most challenging things about being a nurse?
Well, probably anyone has heard about nursing shortage. Everyone's heard about that for decades, right? So that can lead to burnout just historically. I would say specifically with the pandemic, fear, anxiety, we all have COVID-related stresses.
Yeah.
Well, nurses have them at work as well as at home. So they're trying to figure out their kids' schools.
Yeah.
They're trying to figure out all that. And then when they go to work, they have 12 hours of taking care of more patients with less resources.
Wow. And what kind of culture exists at Johnson Memorial Health that really helps support and encourage these nurses? Because it sounds like a lot that they're carrying with them day in and day out.
Absolutely. I recently moved back to Indiana, and so I'll tell you why I chose Johnson Memorial. Really a sense of family at Johnson Memorial. It's a hospital that's taking care of the community, right? So the nurses that work there, their loved ones live in the community as well, so they're taking care of their own. Also, just decision making at the local level. So as a chief nurse, I'm able to impact the nurses at the bedside by getting approvals and permissions and decision making right there within the walls of the hospital. So I have found just in my short time there, I can impact change much more quickly. And then also I wanted to go there because I want to build relationships with every single nurse that I work with, or respiratory therapist, or EVS person. I want everyone to know me as Anne, not as they.
Okay, all right. Well, Anne, if it's okay to call you that. What is something, we got about 30 seconds left, what's something that someone has done for you to encourage you and help you in this season?
I had actually a girls' weekend. After we were all vaccinated, I went on a weekend with some of my girlfriends who are nursing leaders. And I found just sharing my story with people that have been there, it changed everything for me. So I always encourage my nurses to please talk to people that know what they're going through to get support.
Community is key. Thank you so much
Absolutely.
for doing what you're doing and sponsoring the show too through Johnson Memorial Health, Dr.
Great,
Shank.
thank you.
Thanks for being here. We appreciate it.